If your colonoscopy is coming, do not hide Ozempic or Mounjaro. The medicine itself is not automatically the danger. The danger is your team finding out too late. These drugs can affect stomach emptying, bowel prep, sedation risk, and diabetes planning. Tell early, tell clearly, and do not adjust the shot at home before the first prep drink. A colonoscopy has 3 moving parts. The bowel must be cleaned well, you may need fasting and sedation, and your medication plan may need adjustment. Ozempic, Semaglutide, and Mounjaro, Tirzepatide, can touch all 3 areas. That does not mean panic. It also does not mean everyone must stop the medication. The real question is which risk group you are in. That depends on symptoms, dose timing, diabetes status, bowel prep history, and the sedation plan. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. These drugs slow how fast your stomach empties. That means food or fluid may stay in the stomach longer than expected. During deep sedation, stomach contents can move upward and enter the airway. That rare event is called aspiration, which means breathing stomach contents into the lungs. Fasting can look reassuring, but it may not answer every safety question. A careful patient can follow fasting rules and still have slower stomach emptying. That is why medication details, symptoms, and recent dose history belong in the sedation plan. The first surprise is that stopping is not automatically safer. Many lower-risk patients may continue when the team agrees. Higher-risk patients may need longer clear liquids, timing changes, or a sedation check by the anesthesia team. The team is not only asking whether the drug is in your body, they are asking how your body is responding to it. A stable dose with no major stomach symptoms is one situation. A recent dose increase with nausea, reflux, bloating, vomiting, or constipation is another. That split matters more than the brand name alone. Symptoms can suggest that the stomach or bowel is moving slower than usual. A recent dose increase can make those symptoms more likely. Your dose history, symptoms, and reason for use shape the safety assessment. Bowel prep is the next practical pressure point. These medications can worsen nausea, bloating, or constipation in some people. A prep that is usually tolerable may feel harder. If stool is not clearing, the doctor may miss polyps or cancel the test. A clean colon is part of safety, not just convenience. If the prep fails, the procedure may be incomplete. That means another prep, another sedation day, and another interruption to your routine. Constipation before the prep is worth reporting early. Iron pills, fiber products, and constipation treatments should be mentioned before prep instructions are finalized. Some offices give special instructions if the prep has failed before. Do not stop these products on your own, but make sure the office knows. Bowel prep instructions also vary by clinic. Some offices already require clear liquids before colonoscopy, and others may change timing for selected patients. Do not copy another person's prep plan online. Your prep must match your procedure time, sedation plan, and medical history. Now the risk splits again. Weight loss use is not the same as diabetes use. If blood sugar is involved, stopping the drug may affect glucose control. The doctor may need to coordinate with whoever manages your diabetes. Your diabetes medicine list should include insulin, sulfonylureas, and other diabetes pills. Sulfonylureas are pills that push the pancreas to release more insulin. During bowel prep, you may eat less and drink clear liquids. That combination can increase low blood sugar risk. Clear liquids can create another problem. Some are sugar-free and some contain sugar. A diabetes plan may change depending on insulin use, usual glucose levels, and prep timing. Ask which liquids fit your medical plan, not just your weight loss goal. Other important pills can matter too. Ozempic and Mounjaro can delay how some pills are absorbed, which means they may enter the bloodstream later. Tell the team about blood thinners, seizure medicines, heart medicines, and any pill with strict timing. Medicines that slow the gut also belong on the same list. Opioid pain medicine, some nausea medicines, and some bladder medicines can worsen constipation. The team may not change them, but the list helps them judge prep and sedation risk. Contact the office as soon as the colonoscopy is scheduled. This is the timing rule. Last-minute calls leave little room to adjust prep, sedation, or diabetes medicines. If the office uses an online form, still send a direct message. The message itself should be specific. Say that you take Ozempic or Mounjaro, give your dose and give your last injection date. Add whether your colonoscopy uses sedation. Then report nausea, vomiting, reflux, bloating, or constipation. If you are unsure about the dose, bring the pharmacy label or take a clear photo. Do not rely on pen color or memory. Many patients know the brand name but not the dose, and dose history can affect planning. Some details turn a routine message into a faster phone call. Call promptly for stomach symptoms, recent dose increases, diabetes medicines, kidney disease, or severe reflux. Also call promptly for prior slow stomach emptying or trouble completing bowel prep. Once your medication message is sent, ask who makes the final decision. Sometimes the gastroenterologist decides. Sometimes the anesthesia team has a separate policy. Sometimes the prescribing doctor must adjust diabetes medicines. Do not assume one office has told every other office. Procedure day logistics also matter. If sedation is planned, arrange a ride according to the center's instructions. Bring the written medication list, not just memory. A missing driver, missing medication detail, or unclear dose can create avoidable delays on the day of the test. Some centers also verify the medication list again before sedation starts. Once those details are shared, the safest answer comes from the team doing the procedure itself. For many patients, the plan may be simple. Follow the bowel prep and fasting instructions. Continue the medication if the team agrees. Keep instructions in writing whenever the plan changes. Higher risk patients may need to skip or delay one dose, stay on liquids longer, adjust sedation, or reschedule. If your procedure is postponed, ask what to do with the next dose. A cancelled colonoscopy can disrupt both the injection schedule and the diabetes plan. Do not change injection timing on your own. Do not double a missed dose after the procedure. Do not take the injection late without asking. Do not ignore repeated vomiting during bowel prep. Dehydration can become a real problem when diarrhea, low intake, and nausea combine. Hydration deserves special attention. Bowel prep pulls fluid into the intestine and causes frequent stooling. If you are vomiting or cannot keep liquids down, call the office. Call sooner with kidney disease, water pills called diuretics, or if a doctor has told you to limit fluids. Dark urine, weakness, or lightheadedness deserves a call too. Vomiting, kidney disease, and fluid limits are why online comments cannot replace the procedure team. Your plan depends on symptoms, dose timing, diabetes medicines, bowel prep, and sedation. The same drug can lead to different instructions. That is why your timeline, symptoms, medication list, and bowel prep history matter. Colonoscopy on these medicines is manageable. Tell the team before sedation, before they ask. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.